Hey, how you doing? This is Bill Santos, and I just made a new video for my YouTube channel, as you know, and here it is. I hope you enjoyed it. Hey, how you doing? Today is March 10th, 2025, and this is Bill Santos. And today is the day after the 3rd anniversary of my open heart surgery. And look, I'm here. I'm not jinxing it, but yeah, I'm okay. Or mostly. Yeah. On March 9th, 2022, I had quadruple coronary artery bypass surgery. And yeah, I can't believe it's 3 years already. Yeah. Let me tell you a little about what happened that day. I went into the operating room. The surgeon removed a fairly long section of a vein in my left thigh that he would use for the heart surgery to replace 4 of the arteries near my heart. He needed to break my breastbone, my sternum, to access my heart. After he finished reattaching the or attaching the new blood vessels to my heart, he attached a metal sternal plate to my breastbone to hold the 2 pieces of my breastbone together to heal. Put it there, screwed it with a screwdriver, I guess, because there were screws in it. And I was set, I was all ready to start the healing process, which I did, with physical therapy, occupational therapy, fine. Everything was going smoothly, except 2 months later, in May 2022, I started experiencing severe chest pains. A wonderful wife brought me to the hospital, where I was admitted because the screws had come loose on the sternal plate and I had developed a staph infection within my chest. So I had to have surgery to open me up again. The surgeon opened me up again and took out the sternal plate, took out the screws. I'm not sure if he put wire in there, because that's the usual procedure, is to put wire to hold the sternum together, pieces of the sternum together. But that's not all. After he did that, he took out the sternal plate and the screws and cleaned out the infection in my chest as much as he could. But they decided to leave my chest open for a week. Yeah, how about that? Yeah, it wasn't like open to the air or anything. The incision was from here to here, so I had like a dressing here with a tube going to a wound vacuum. So for about a week, I had this wound vacuum sucking the discharge and crud out of my chest. Yeah, it was painful. Yeah. Okay, and after about a week, the surgeon closed me back up with 7 sutures, which left me with 8 holes in my body from about here to here. Holes like all the way through, like you could stick your finger all the way through into my chest cavity. They replaced the dressing for the wound vac, and I was just on the wound vac for 24 hours a day, 7 days a week for weeks and weeks and weeks. I was in physical rehab facility. I had a wound care nurse, a guy, he was a great guy, wonderful guy. He would come in every 2 to 3 days, peel off the strip, bandage, kind of clean me up a little bit here with alcohol and stuff, and put a new one on and pop the vacuum on again. And that was good for about 2 days. I would suck it on my chest for 24 hours a day for another 2 or 3 days. The good thing was, even though it was very painful, what the wound vac does is it pulls on the skin, and it makes the wounds heal faster because it closes them up because of the pressure pulling on them. Anyway, today, and as usual, my chest is still numb in this area here. It occasionally hurts. It's not hurting now, which is nice. And that's it. That's about it. I'll tell you real quickly. Those were 3 surgeries in 2022. 2023, I had 2 surgeries on my spine. One to remove an abscess infection in a disc in one disc in my spine, and it was in September 2023. In October 2023, I had a major surgery. Had bone infection in my spine, and my surgeon told me that my spine was collapsing and I needed immediate surgery. So I went into the operating room. The surgeon attached a titanium metal rod to my spine for stability, and so it doesn't break in half. Thank God. And I had to deal with more pain with that. And then April 2024, the next year, I had very minor surgery on my right ankle. This time my podiatrist did the surgery. He had to I had bone infection in my right ankle, so he had to take a bone biopsy, drain the fluid, and do a deburring, which is kind of cutting or scraping off infected bone. It's been a crazy 2 years medically. 6 surgeries in about 2 years. It's too much, man. But I'm doing a lot better. Actually, my podiatrist years ago, or not, fairly recently, performed 4 surgeries on my left foot. Had to remove some decayed bone and scar tissue, and he had to remove the joint on my middle toe of my left foot, so it looks kind of weird. It's sinus surgery to remove 8 polyps in my sinus and nasal cavity. I had a pleural effusion several years ago, or 2 different times. I had one to remove fluid surrounding my left lung and one to remove fluid surrounding my right lung. That's easy, kind of hurts a little bit, but the doctor or surgeon or whoever it was just numbs the area with numbing stuff, which really hurt. But when he sticks a needle like a catheter through my back into my chest cavity to suck out the fluid that was surrounding my lungs. It didn't hurt, but it just kind of felt weird how this like kind of thin thing like going through you. The first one wasn't on my left lung wasn't too bad, but I think it was a few years later I had one done on my right lung, and I had to have 22 ounces of fluid sucked out that was surrounding my lung. not inside my lung, but around my lung. And that was it. That was kind of a surreal situation because he did. I mean, I knew what it was going to be like, so he did it, and then I'm just like sitting there, waiting for them to kind of finish up, and this guy comes out this way, and he's holding this big glass goblet of this kind of clear, white, milky stuff. And I asked, what's that? And he said, yeah, we just took this out of you. And I'm like, it's like 22 ounces. He said, yes, about the amount of 2 cans of Coca-Cola. I'm like, oh my God. Anyway, a lot of crazy things, man. Medically, 1977, when I was 16 years old, I had Rocky Mountain spotted fever. Had kidney failure, both kidneys. Stopped working because I was on an intravenous antibiotic for a few weeks. They just stopped. I had to be rushed to the hospital. They put me on dialysis for 6 weeks. Every day, 4 hours a day for about 6 weeks. And thank God my kidneys are back to normal. It only took 6 weeks to get them to function again. And I thought it was kind of like I was in a movie, because I was in there in the facility with all these unfortunate people who had to go to dialysis every day to live. It broke my heart. And I was just there doing, it was about 6 weeks into the dialysis, and my doctor runs in to the room and he goes, "Stop! Take him off dialysis, he's healed." And I'm like, yeah. But it's good, I'm dealing with other stuff. I hate to burden you with all this other stuff, but I spent 2 years in the pre-med program at university, so all this stuff fascinates me. I'm starting to go on and on. But, yeah, it's been crazy. And hopefully, this will be the end of it, although I'm dealing with congestive heart failure. I'm taking some medication for that. I'm doing a lot better, thank God. I'm also dealing with restrictive lung disease. I'm having trouble breathing. It's been worse lately. As you can hear, my voice is a little bit gravelly because of the inhaled medication that I've been taking. But I'm just telling you this for information purposes. I don't want any sympathy. There was a point after the chest surgeries, I was in so much pain, and you kind of get to thinking, why me? Why God? Why are you doing this to me? But that only lasted a very short while because you can't think that way. You have to take responsibility and be strong and get through it and get yourself healthy again and strong again. I'm not able to walk yet. I'm using a transport chair, which is like a wheelchair, and a walker. I'm on oxygen most of the time, supplemental oxygen. And the problem is I have kind of severe peripheral neuropathy in both of my feet, so both of my feet are numb. So that's another kind of thing that makes walking a bit of a challenge. But I'm going to do it, man. I'm going to get stronger and be able to walk again. I'd like to thank my wonderful wife, my terrific mother, the doctors, nurses, physical therapists, occupational therapists, and you for praying for me. And for all your support. I'm lucky, fortunate, and definitely blessed to be here. Look, I'm 6 surgeries in 2 years, and I'm alive and fairly healthy. Sorry to go on so long. So, thanks for watching, and stay watching for a few more seconds because I'll show you a photo of myself that my wife took on this day, March 10th, 2022, which was the day after my heart surgery 3 years ago. That's it. And of course, we've been listening to Vivaldi, Four Seasons, Spring, and bye for now.